Good morning. It's been 83 days since the WHO declared COVID-19 a global pandemic. And now around the world, there are more than 6.2 million cases. In Canada, there's been a positive sign. We've actually, the daily case count over the last 7 days is 18% lower than the previous 7 days. Our case count in P.E.I. has not changed. It still remains at 27, and all have recovered. And since we last spoke, 590 new negative tests have been reported. So over the weekend in New Brunswick, many of you have heard that 12 cases were related to an essential worker. And it's a reminder of the impact of not only a case, but an outbreak in an area and how that impacts the whole community. It reminds us about the potential spread of this virus. Our public health order has been renewed, effective yesterday, and in relation to New Brunswick, there was an exemption for essential workers that were traveling back from New Brunswick, that they did not need to self-isolate. That exemption has been removed, meaning that essential workers returning from New Brunswick must self-isolate. In terms of testing, it's very important if you're experiencing any symptoms related to COVID-19 that you do get tested, that you contact your doctor, nurse practitioner who can refer you, or call 811. And when we talk about the criteria for testing, and I think it's worth mentioning that in the public, any person with COVID-19 symptoms should be tested. And of course, anyone who's a close contact of a lab-confirmed case, even within 48 hours prior to the case developing symptoms, would be tested. Hospitalized individuals, for instance, those with influenza-like illness, fever, or new or worsening cough, for instance, would be tested. Healthcare workers with symptoms, healthcare workers who traveled to P.E.I. to work or who have traveled out of the province to be tested. Staff of our QEH microbiology laboratory. New residents of long-term care facilities are tested prior to admission. And of course, if there was ever a case in long-term care, staff and residents would be tested. Patients that transfer between healthcare facilities are done as per protocol. Our temporary foreign workers prior to the end of their self-isolation period are also tested. Our essential workers with frequent travel outside of P.E.I., such as our truck drivers, are being tested. And those are to list some of them. We also will be testing those on autopsy going forward as well. So yesterday marked the first day of phase 3 for P.E.I. So more businesses are open, restaurants, gyms, playgrounds and parks, personal services, some sports are being played, and more daycare spaces. And our island businesses and organizations have really adapted quickly and put plans in place to protect themselves, the customers and clients, and in turn the community as a whole. And I want to commend them on a wonderful job as we all adapt to a new way of doing things. And yesterday was also the beginning of visitation in long-term care facilities. And it has been a challenging time for us and loved ones in long-term care to be apart. And it is wonderful to see families reunite and have some in-person visits. Yesterday, the application process for seasonal residents to return to P.E.I. opened, and thank you for your patience. The Office of Public Safety received a large number of applications in just one day. And of course, these applications are not just seasonal properties, but also those traveling for compassionate and essential reasons. I said this before, this will not be a rushed process. It will take time and needs to be done carefully and correctly. Public safety will review, and the process will start with our Atlantic provinces and territories, first for seasonal resident requests, and then we'll compile other requests as well coming through. And a reminder that seasonal properties are fixed roof dwellings. This does not include RVs or campers on someone's land. Seasonal residents must apply online and be approved before traveling to the province. They must have their self-isolation plan in place and will be receiving calls after they arrive. And before they complete their self-isolation, they will be tested for COVID-19. There'll only be a maximum number of seasonal residents processed per week to make sure that there's capacity to do the operation isolation calls as well as the testing. A reminder that although essential workers must travel in and out of Prince Edward Island, this should be done for the purpose of essential work the person is doing. I know that large gatherings, weddings, funerals, and graduations are all important. However, with our mass gathering limits at this point in time, it's not a great time for these large gatherings to happen. We've talked about before, as the summer goes on, those gathering numbers will, we anticipate will change, but at this point in time, it isn't there to have a large wedding or a large graduation. It does not mean it cannot happen, it just means it cannot happen now. As we start into phase 3, we shouldn't take the new freedoms in some ways that we have been put in place for granted. It's extremely important we do not forget the basics. And so looking no further than our neighbors in New Brunswick, as they experienced an outbreak after someone who did not self-isolate, it's another example that it takes one person. And when we have no cases here in P.E.I, it's easy to say maybe we don't need restrictions, but it's important that to remember that the risk exists, and it still exists. We are slowly and surely navigating our way through this pandemic, but it is not time to go back to the way things were before. We need to remain diligent and continue self-isolating when required, practice physical distancing, washing our hands, using enhanced cleaning measures. This is going to be part of our new normal for quite some time. We will need to find the balance as we go forward, how to control COVID-19 in our province, in our country, and how we continue to have society function. And these are the goals of the pandemic goals for the country and for P.E.I, and how do we balance those going forward? Someone gave me the book on the weekend called The Boy, the Mole, the Fox, and the Horse. And there was one line in it when I read through it that said, I quote, "We have such a long way to go," sighed the boy. "Yes, but look at how far we've come," said the horse. And I thought that seemed apropos for what we have gone through in the last weeks and what lies ahead in the weeks looking forward. So, as I often say, let's look after one another, let's be patient, let's be kind, and we're going to get through this. Thank you. Encore en français. Okay. Je vais juste dire quelques mots en français aujourd'hui. C'est 83 jours depuis l'annoncement que c'est une pandémie globale. Mais au Canada, nous sommes presque 92 000 cas et plus de 7 300 morts. Il n'y a toujours pas de cas nouveaux à l'île du Prince-Édouard. Si vous présentez des symptômes de COVID-19, allez vous faire tester et au besoin, vous irez vous faire tester à une de nos cliniques à Charlottetown ou Summerside. Hier, c'était le jour 1 de phase 3 de notre plan provincial. Plus de commerces sont ouverts comme les restos, les gymnases, les terrains de jeu, les parcs, les services personnels, les organisations de sport, les services de garde et encore d'autres. Les commerces insulaires ont bien adapté leur opération pour recevoir leurs clients et pour protéger tout le monde aussi. La communauté, de leur côté, a aussi rapidement adapté à ces changements et je tiens à remercier tout le monde pour une job bien faite. Hier, on a aussi commencé à avoir des visites entre familles au foyer de soins. Ça a été un long défi pour tout le monde et je suis bien contente de voir les proches se réunir. Je vais juste mentionner que pour les travailleurs essentiels, un rappel important que vos déplacements sont uniquement pour aller au travail et pour rentrer chez vous. Et les rassemblements de grand nombre comme les noces, les funérailles, les convocations sont importantes, mais il y a des maximums et malheureusement, ce n'est pas le temps pour ces rassemblements. C'est une pause, pas une interdiction. Il est essentiel que nous tenions à cœur les mesures sanitaires que nous avons adoptées depuis le début. Nous avons tout vu aux nouvelles, ce qui est arrivé au Nouveau-Brunswick. Une seule personne ne s'est pas isolée. Il y a eu une chaîne d'événements avec beaucoup de conséquences. C'est bien facile de dire que nous devrions relâcher tout quand nous n'avons pas de cas, mais il est important que nous gardions en tête que le risque est toujours présent. On observe la situation au quotidien. On passe à travers chaque phase de notre plan doucement, tranquillement et avec attention. Ce n'est pas le temps de retourner à la façon de faire d'hier. On doit continuer à respecter les mesures et les consignes en place, laver les mains, la distance physique, nettoyer les surfaces partagées. Ce sont des nouvelles normes qui resteront avec nous pour un bon bout de temps. C'est une question de se protéger les uns et les autres. Merci. So I'll turn over to you, Mary.
Good morning, everyone. With the beginning of Phase 3 yesterday, Health P.E.I. has also made changes to our broad visiting restrictions across all our health services, which now allows limited designated visitors within all facilities and care areas. Patients and clients may now select 2 designated visitors to see them. Additionally, those patients who are nearing the end of life may have a total of 6 visitors, with only 2 visiting at one given time. Additional exceptions are being considered on a case-by-case basis and for compassionate reasons. Visiting protocols are put in place to maintain physical distancing requirements, and visitors will be screened for illness and are required to follow infection control guidelines as relayed by the healthcare team in our facilities. Any visitors with symptoms of COVID-19 will not be allowed to visit. And our visiting protocol also permits patients who are coming to Health P.E.I. hospitals and clinics for an appointment or procedure to select one person to accompany them to these visits. Patients must let the service area they're attending know in advance if a support person will be coming with them, so that plans can be put in place to maintain physical distancing in those areas. We do recognize that visiting and support from family and friends are extremely important for the well-being of our patients and residents. And as we continue to respond to COVID-19, every effort is being made to allow safe visiting when possible and to maintain ways other than visiting in person to connect with family and friends. There's been a lot of ongoing discussion and previous conversations here around our plan for COVID-19 units within our long-term care homes and for long-term care residents, and I'd like to clarify some points of our plan. We've heard a lot of feedback on our initial strategies as much as we've learned from the virus and the impact in that individual population within our long-term care homes. And we've taken from that, as well as having our plan developed and designed by our physicians and clinical staff, working with the Chief Public Health Office, the Health P.E.I. administration, and the Department of Health and Wellness on the best evidence and how to appropriately limit the spread of COVID-19 to our most vulnerable islanders. We in P.E.I. have the advantage and good fortune of not having an outbreak within a long-term care home. As we see the devastating effects on residents across Canada, we have been able to learn from their experience and have created a plan that provides barriers to the virus spreading, as we've seen in so many other situations. The first important step we have taken is establishing a mobile rapid response outbreak team of clinical staff who would respond immediately to support a suspected outbreak in any long-term care home, whether it's a public facility or privately run facility. This team will assist staff with their expert knowledge on how to isolate residents, support the testing and tracing of contacts, and ensure the safe transfer of any residents to a COVID-19 care area. The second important piece of our plan is creating open COVID-19 spaces to house long-term care patients safely and provide them the care they will need. Our first established unit will be at the former Riverview Manor, and this space is being fit up to accommodate up to 25 patients initially and up to 49 residents if needed. This space has been air quality and water tested, and everything has been reviewed to be able to provide excellent care in a home-like environment for residents. At the same time, we acknowledge the potential high level of spread of the virus that we've seen across Canada and around the world within long-term care, and we may need to establish additional space to care for these types of residents should this happen. For that reason, we're also planning for additional space through creating units within both the Prince Edward and Somerset Manor as they become available. So that means that earlier we were looking at moving residents from within those homes to create this space originally, and now we have the space identified at the former Riverview Manor to be able to accommodate some of these residents. So we will now create the additional spaces at Prince Edward Home and Somerset Manor as they become available. So residents will no longer have to share rooms if they are moved within those homes to create this space. However, if we do have an outbreak on P.E.I. within our long-term care home, we want to make it clear that we would have to speed up the emptying of the COVID care areas within these homes. In that case, we need to respond quickly, and residents may have to move to shared accommodations until space is otherwise available in order to maintain the safety of the whole long-term care population. These COVID units within those homes will be completely separate from the rest of the home, with no shared entranceways to access the home from within the unit. They will have separate designated staff who will not interact with the staff throughout the rest of the home. And in fact, the COVID unit staff would even have separate parking lot from the rest of the home staff. This plan is a best practice framework that ensures our long-term care residents get the care they need, and it's done so safely and effectively. I'd also like to update a little bit on the work being done to rebook surgeries that were canceled as we started our response to the COVID-19 and moved to essential services. In total, within Health P.E.I., 1,120 surgeries and procedures were canceled. This week, additional Health P.E.I. services have been reintroduced, and some of those already opened up have again increased volumes as we continue with our phased approach. As such, some of the surgeries that were canceled have already been completed. In May, 517 surgeries were completed across P.E.I., and that included 147 elective surgeries. This is the beginning of addressing the list of surgeries that we unfortunately had to delay, but we know that islanders need. Precautions are being taken to limit the number of patients in waiting rooms and ensure appropriate scheduling of patients to avoid having too many people in one place at one time. All services are being monitored to make sure we maintain the capacity to respond to future waves of COVID-19 and P.E.I. should we have an outbreak. And it also includes the ability to go back to essential services quickly if our response level has to change as a province. Just a reminder, patients will be contacted by Health P.E.I. or their specific healthcare provider to rebook any appointments or procedures if they have been delayed. I want to thank everybody again for your patience in working with us, and also with your patience in reestablishing those visiting relationships with your loved ones in our care facilities. And we appreciate how difficult this has been for everyone as we move through this together. Thank you.
Just before we go to questions, just wanted to do a fentanyl-related update. We've had 5 cases since May the 5th. 4 out of 5 report heroin use. 3 out of 5 report cocaine use. 2 of the cases are in their 20s. 3 cases in their 30s. 3 males and 2 females. And when we announced the overdoses related to fentanyl a few weeks ago, the purpose was to protect Islanders who might be consuming illicit drugs, which is why I'm mentioning it again. And it's important whether or not an overdose resulted in an ER presentation or death. The CPHO has an established relationship with the Chief Coroner's Office through which we conduct surveillance of accidental opioid-related deaths. We do report regularly on our fentanyl-related overdoses as well as fentanyl-related deaths, and we do so nationally, but it is based on when a coroner's report is confirmed and submitted to our office. I would like to highlight the collaboration with police and public safety and community groups in terms of our overdoses. And en français, on a 5 cas depuis le 5 mai à propos de mise à jour sur le fentanyl. 4 sur 5 sont reliés à l'héroïne, 3 sur 5 sont reliés à la cocaïne. 2 cas sont des gens dans leur vingtaine, 3 cas dans leur trentaine, 3 hommes et 2 femmes. Et quand nous annonçons ces informations sur les surdoses de drogue, c'est pour protéger les insulaires qui utilisent ces drogues. C'est pour souligner les risques, peu importe si les utilisateurs se rendent à l'hôpital ou si ça résulte en surdose. Il existe une relation entre mon bureau et le bureau de médecin légiste en chef. Et les informations reliées aux morts causées par le fentanyl sont envoyées au gouvernement fédéral, mais elles sont basées sur les infos données par le bureau du médecin légiste. Et puis aussi mentionner qu'on travaille avec nos collègues, les policiers, en justice et les groupes communautaires aussi. Thank you. And now I'll open it up to questions.
Brian Higgins, CBC.
Hi, Dr. Morrison. Can you tell us more about the new requirement for essential workers returning from New Brunswick to self-isolate? Is that to healthcare workers only as opposed to truckers and whatnot? Is this in response to the situation in northern New Brunswick, and how concerned are you about that?
Hi, Brian. So as you know, the requirement for people traveling to Prince Edward Island is to self-isolate for 14 days, and that has been across the board. At one point, a number of weeks ago, because of the situation in Brunswick, we provided an exception for those who were essential workers who were going back and forth from New Brunswick, so that they would not always have to self-isolate when they came here, and that was based on the situation in New Brunswick. But after the outbreak in New Brunswick this weekend, we have removed that exemption. And because we'd like to see what happens in the next couple of weeks in New Brunswick. We recognize there's a lot of movement of goods, for instance, between New Brunswick and P.E.I. There, we have construction workers that may be coming back and forth. And then essential worker, so a broad category of essential workers. Healthcare workers are essential workers, but they have also a category of exemption. So healthcare workers and other essential workers may be able to go to work, but they have to self-isolate when they're not at work. And for our healthcare workers, they would be using appropriate precautions when they are. And that is whether they are traveling over from Nova Scotia or New Brunswick. But our healthcare workers, we've been doing something a little bit different in this province and sometimes other places. If you are a healthcare worker that is coming to work here in P.E.I. from somewhere else, you would be tested when you arrive here. So if you were due to start work tomorrow, you would get a test back and it would be negative before you start to work. And then for healthcare workers who are going back and forth all the time between, for instance, Halifax and Charlottetown, then you would be tested every 7 days. So we have been using our testing for our healthcare essential workers on a regular basis.
Louise Martin, CBC.
Oh, hi there. Thanks for taking the call today. And my first question would be about the seasonal residents. You said you had a high volume of residents applying. Can you be a little bit more specific on, how many people have applied so far? I know it's just started yesterday.
So the calls would have gone into, or the applications process goes into public safety, and I believe they had over 700 applications that went in yesterday. But of course, they would not all be processed, and they'll start going through and identifying which ones would be, for instance, from Nova Scotia.
Okay, so it still is maritime first then. And my second question is about phase 4. I see on the website it mentions the date June 12th, and then it doesn't list any specifics other than dental hygienists. So is there any more details we can provide today, or you can provide today, on phase 4? Does everything sort of begin June 12th, and is there anything, any more clarity around what else that involves for phase 4?
I'm so glad you asked, Louise, because that should not be on the website. There's June 12th was the beginning of phase 3, which maybe you recall that we've pulled up because we were doing so well to June 1st. So the June 12th is not, shouldn't be there. It's really, it started yesterday, the phase 3. And in terms of going forward, we're going to be meeting this week. We're looking at what phase 4 would look like, but that is not anticipated until end of June, early July, and one of the things we'd be looking at is that the gathering number, for instance, would that be able to be increased? But I remain cautious, and I'll be honest, a little worried about what may happen in the next few weeks or next couple of weeks as we've opened up here in Prince Edward Island. So I think that's why I mentioned the testing, because it'll be really important if people get symptoms. We want to monitor what is going on in our community here as we've opened up in phase 3. But phase 4 would not be anticipated for a number of weeks.
Okay, thanks so much for clarifying that. I appreciate it.
No, that's,
have a good day, guys.
Yeah, great.
Allison Jenkins, The Guardian.
Good morning. Hello. I have a question about the complaints line, and just hearing a report that on the weekend a couple of people tried to call and got a message, but then the message box was full. Just wondering how that's getting handled and how many complaints have been coming in, and was that message that the mailbox was full, is that a mistake or what? So I guess the numbers and the procedure for weekends.
Hi, Allison. I guess I did hear that the phone line at Public Safety did get filled over the last number of days. So, and that I think was more related to questions about applications for coming to Prince Edward Island. Over the weekend, I did not get the report that the 1-800 line number was, people were unable to leave the message, but if that's the case, that's unfortunate. I know that they take the calls off early in the morning, and so there may have been an increased volume of calls in the last couple of days. And they sit outside my office, so I know they're answering the phones and are busy doing so. So I can certainly follow up with that after today. But they've been trying to get back to people as best they can. In terms, I didn't bring numbers of complaints, but certainly we can provide those for you, Allison. And but there have not been a significant number of increases in complaints, as far as I understand.
Okay, so there's a public safety phone and a 1-800 line as well. And just where can people find those numbers, just to be clear that they're calling the correct number and getting through to the right people?
Well, our 1-800 line has been our 1-800 health info line, and we've been using that really since the middle of March, so that has been pretty well established, and I know it's on the website, and it's about answering questions related to COVID-19. It's around, they've answered an array of different questions, but also it's also being used if people do have a complaint about a gathering they're seeing, or concerns around practices of business or organization. Sometimes those complaints are coming in that way as well. And so that is the number that has been used for those cases. The public safety number is used, it's mainly on an email and an online application, but I know there's a number associated with that. I haven't called it myself, so I can't remember it off the top of my head. I don't know it, but I'm sure, Allison, that communications can get those to you.
Thank you very much.
Carrie Wynn McLeod, Ocean 100.
Good morning, ladies. I'm just looking for some clarity regarding the seasonal resident process and the application and how it's all handled. I know we've divided them all into like 3 groups, being Atlantic, the West and the Territories, and Ontario and Quebec. So starting to process the Atlantic ones, if you get through all those, are they just immediately moving on then to the next group, or is there a timeline there saying, okay, well, Atlantic is going to be like the first 2 weeks, so we won't start processing any of the ones from the West until, like, for instance, June 14th or something?
Hi, Carrie Wynn. So I think we spoke about this on Thursday too. The process is really just started yesterday. So I know that public safety is trying to make sure they have the capacity to process these applications. We also have put a maximum number, because of the capacity of our self-isolating callers, as well as our ability to test people. So we've wanted to make sure that there's capacity for all those things in place. And that's why we indicated there don't be only a maximum number of people coming in per week. And, we think normally we get 1.2 million tourists, I think, here in the summer. So thankfully we're not having to process, we're dealing with small numbers here, relatively speaking, and we're going to do it carefully. And so, for instance, maybe there are only a certain number of seasonal residences from BC and Saskatchewan and Alberta. So those will be, dealt with and up to a certain maximum, and then they'll move on to the next week. So I think it's they're going to have to also figure out how many they're able to process public safety per week. But we know we won't do more than a certain number, and that's based on capacity as well. So they're starting to look at them today, Carrie Wynn, and I know there's lots of interest in how this will work, but we expect the Nova Scotia, New Brunswick seasonal residents to start coming sometime after the middle of June. And of course, some of them may not want to come until July, and that's fine too.
Sure, yeah, I was aware of the 500 number being processed per week, but I just wasn't sure exactly what that meant. Are they processed and then they are told, okay, well, you can come now? Like, are they approved then as soon as that process goes through to arrive immediately, or is it set like, okay, well, after June 7th you can come type thing?
Well, there's I think a day that is an anticipated day that they could arrive after that day, but there'll also be some questions about, well, when are they wanting to come? So because maybe they don't want to come until mid-July. So that, and that's okay too, but it would be after a certain day that they would be able to come, because again, it's related to our capacity to do testing and to monitor them in operation isolation when they get here.
And just a second question regarding particularly the New Brunswick residents. Since the contact tracing there has expanded now, outside the Campbellton area, has there been any thought to moving like the New Brunswick seasonal applications further down the line?
So we're going to be watching it very carefully, and it will be clear that if something changes in New Brunswick, or if it ever changes in P.E.I, we can alter the arrival of seasonal residents. So we'll have a much better sense within the next couple of weeks. So that will be part of it, and an important part of it, that it can change.
Julien
Great,
Natacha,
thanks.
Radio-Canada.
Bonjour, Dr Morrison. Première question toute simple. Serait-il possible de traduire la première réponse que vous avez donnée à Brian concernant l'évolution de la situation avec le Nouveau-Brunswick? Qu'est-ce que vous demandez aujourd'hui aux travailleurs essentiels qui vont et viennent entre le Nouveau-Brunswick et l'île du Prince-Édouard? Et est-ce que vous avez un nombre? Est-ce que vous savez combien de personnes de l'île du Prince-Édouard travaillent au Nouveau-Brunswick?
Bonjour. On sait que c'est un assez grand nombre qui travaille entre les deux provinces. Et puis, mais je n'ai pas un nombre exact, mais c'est le nombre le plus grand qu'on voit qui voyage par le pont. Et puis, alors maintenant, on a tout le monde qui vient à l'île du Prince-Édouard vraiment doit auto-isoler pendant 14 jours. Sauf que depuis il y a plusieurs semaines, on a fait une exemption pour les travailleurs qui vont entre Nouveau-Brunswick et l'île du Prince-Édouard. Parce qu'il n'y avait pas des cas là-bas ou ici, puis ils sont... c'est toujours en transition entre les deux provinces. Mais depuis le week-end, on a enlevé cette exemption pour que les travailleurs essentiels auto-isolent ici quand ils retourne du Nouveau-Brunswick. J'espère que ça ne va pas rester en place pour toujours, mais pour maintenant, je pense que c'est important. Et pour les travailleurs qui travaillent à l'hôpital, pour l'instant, ils peuvent travailler, mais on les teste s'ils viennent de notre province et on teste en venant ici, mais aussi 7 jours après. Et en particulier, les travailleurs qui travaillent à l'hôpital qui voyagent souvent entre peut-être ils travaillent en Nouvelle-Écosse et aussi ici, comme exemple. Les travailleurs à long-term care, ils n'ont pas une exemption, ils ne peuvent pas travailler à long-term care pendant 14 jours.
Un follow-up, Dr. Morrison, toujours sur cette situation avec le Nouveau-Brunswick. Est-ce que ça va concrètement, cette situation au Nouveau-Brunswick, ça va changer quelque chose pour les personnes qui appliquent pour venir ici dans leur résidence secondaire? Et est-ce que aussi ça pourrait changer au niveau de la bulle entre l'île du Prince-Édouard et le Nouveau-Brunswick? Est-ce que tout ça, on va reculer tout ça à cause de la situation au Nouveau-Brunswick?
À ce moment, on va regarder attentivement ce qui arrive dans les 2 semaines qui suivent à Nouveau-Brunswick à propos des résidents saisonniers. Et même sorte de choses on a discuté la boule entre les maritimes et puis on a parlé de ça le fin juin, 1er juillet, mais encore on va regarder ce qui arrive dans les semaines qui suivent.
Merci.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr. Morrison. J'ai une question sur le nombre permis de personnes, enfin le nombre autorisé pour les rassemblements à l'extérieur. Je crois que pour la phase 3, c'est 20 personnes à l'extérieur, 15 personnes à l'intérieur. Sur le site du gouvernement, en français, il y a une page pour les lignes directrices qui indique que c'est 50 personnes à partir du 1er juin. Est-ce que vous pouvez confirmer que c'est une erreur?
Je pense que c'est une erreur, oui. On va discuter avec notre équipe qui prend soin de ça et on va le changer.
D'accord. J'ai juste une autre question sur le début de la phase 3. Vous aviez mentionné il y a quelques semaines qu'il y aurait des vérifications dans les restaurants ou dans les commerces pour voir si la distance physique est bien respectée. Est-ce que vous avez connaissance si ces contrôles ont déjà commencé?
On a discuté ça hier avec l'équipe et puis commence cette semaine d'en faire la plupart de notre Public Health, Environmental Health Officers. Ils viennent de commencer ce travail au resto et ils font les inspections, mais aussi ils vont regarder pour la distance entre les tables et les choses qui sont plus reliées au COVID-19. Alors, j'imagine que ça va commencer, je ne sais pas si c'est aujourd'hui, mais cette semaine, j'imagine.
Merci.
François-Pierre Dufault, Radio-Canada.
Good afternoon. Une question pour vous en français, Dr. Morrison. Puisque les plans de bulles de déconfinement avec le Nouveau-Brunswick sont retardés, en tout cas à cause de la situation dans cette province-là, est-ce que c'est envisagé de votre côté peut-être de procéder avec la Nouvelle-Écosse d'abord, puisqu'il y a moins de cas dans la province de la Nouvelle-Écosse? Presque plus de nouveaux cas sont concentrés surtout dans un foyer de soins du côté d'Halifax. Alors, est-ce qu'il y aurait moyen de déconfiner avec la Nouvelle-Écosse via le traversier de Wood Island avant même de faire une bulle avec le Nouveau-Brunswick?
Et puis, c'est vraiment, en commençant, je dis que c'est la boule, l'idée de la boule n'est pas vraiment retardée parce que on n'a jamais pensé d'en faire avant le fin juin, 1er juillet, alors on va voir. Mais je pense que les premiers ministres, quand ils en parlaient, puis ils aimeraient en faire ensemble avec les maritimes. Alors, on est en train, on les discute entre les médecins de chef avec mes collègues, Dr. Strang et Russell, mais je sais que les premiers ministres en parlent aussi. Alors, on va voir. Je pense que tout le monde espère que ça va arriver. Et si oui, on peut avoir les familles qui viennent sont auto-isolées pendant les 14 jours.
Un suivi, si je peux me permettre, Dr. Morrison, à ce sujet-là aussi. Est-ce qu'il y a une date qui a été établie pour permettre aux passagers, les passagers à bord de voitures, d'aller sur le traversier? Pour l'instant, c'est seulement les camions, mais est-ce qu'il y a une date qui a été avancée? Est-ce qu'il y a des contrôles qui pourront être faits à ce moment-là?
Je n'ai pas une date qui n'est pas une date avancée pour le traversier encore, mais c'est seulement camion. Alors, j'imagine qu'on va en discuter, mais je n'ai pas une date avancée. J'ai pas une date encore.
Merci.
Okay. I'll just translate a couple of the last questions. Is there a date yet for where passengers can go on the Northumberland ferries? And that there is not a date yet for that. At this point in time, it is trucks, commercial trucks only. And the other question was, when do we expect inspections to occur at restaurants that would also be looking for physical distancing. And so we have spoken about it yesterday, and we expect that to start soon, where they'll be doing, for instance, our environmental health officers going in to do eating establishment inspections, but that would include making sure the tables are 6 feet apart, et cetera. So we expect that to begin shortly.
Rachel Collier, Eastern Grass.
Hi. Today I'm just wondering, Dr. Morrison, what you know about businesses following their operational plans. Have there been many complaints, or have you needed to follow up with any kind of correctional actions?
Hi, Rachel. So there have been a couple of concerns that have been brought forward, and these we've said all along are dealt with first from an educational point of view, and a follow-up to the business, for instance. And so I think that's where it has started. I don't believe any charges or anything like that have been laid in that regard, certainly in these recent openings. And I've been really impressed. I haven't been out very many places myself, but certainly others reporting to me how impressed they are at how many businesses have, the measures that businesses have put in place and what they've done and how organized they've been. And so that is really good to hear, because it's really putting the safety of islanders and their staff first and foremost as they reopen their doors. So it's been certainly a very positive feedback and less complaints.
Okay. And I guess since you mentioned a few more cases of fentanyl-related overdoses, I'm wondering if you might have details about, is there possibly a trend of region where these overdoses are happening that you could offer without kind of breaking people's confidentiality?
I wasn't sure I could hear the question very well, but if the question is there a reason these are happening? I mean, I think the concern.
Actually, like a reason, as in, would they all be happening in a certain place on the island, in a certain area of the island, or anything like that?
Yeah, so they're not all happening in one particular location.
Okay, so it would be spread across the PEI generally speaking.
Yes. Okay. That's great. Thank you all very much.